8:35 item is our COVID update, and we have with us via Teams meeting, we have Kathy and Jamie and Becky. And Kathy, I believe Steve's going to run the deal for you, but go ahead, Kathy. Good morning.
Oh, good morning, Mr. Chair, Commissioners. Can you hear me okay?
Yes. We hear you fine, yes.
Okay. And I have my screen up so I can't tell. But Steve, I'll let you know is there it is. Okay. Sounds good. So I'll start with our usual data. So our active cases in Clay County, you can see December 20th, they were 397. In the 27th now, again, due to the holiday weekend, the numbers haven't quite caught up. The active numbers have declined 325. So depending on when they catch up, it's not exactly an accurate number. But the active cases in Minnesota, we also see 27,085 on the 20th, and then 26,106. So again, they may catch up a little bit after Christmas weekend. Active cases in Cass County, same thing with their number 696, and now their number is 599 for the 27th. And active cases as well, 2,100 on the 20th, and now we see it decline at 1,858. And again, maybe catch up because of the holiday in there. Okay, next slide. The active cases by age. So again, this is our breakdown of age groups. So we continue to see the high numbers in the kids and the young adults. The largest spike number is that 35-39 age range, but then we see quite a variant high numbers in this, even from 0 to 4 to 15 to 19 being some of the active cases highest rates. Next slide. This one is the cases per week.
Just a week.
Is that one up? The number? Oops, did I miss that? Sorry.
I think we're working on it here, Kathy. If you can just hang on a minute. There we go.
Okay, there we are. Cases per week since August to current. And this is just the overview of the cases, which we're right around the time we see the case numbers climbing after that summer lull. And then that gray bar at the very end is really a preliminary number for cases from the 19th through the 25th of December. So that's at 152 so far, and that number again will likely go up once the data catches up. And this is our case trends per week. So starting in March of 2020, the beginning kind of when we started those cases on the pandemic. And then it shows the overview of those 4 main waves we've seen in comparison to where we are currently. And this is accumulative cases by age. We see a total cases of 13,080 since March of 2020. And this graph again shows the breakdown of the numbers in all those age categories. And we see the highest number being the 20 to 24 range, and then in the 30s, 30 to 40 range, there's some high numbers as well, and that's cumulatively. And I think, Becky, do you want to continue with the transmission?
I can do that. Good morning. Can everyone hear me okay?
Yes.
Hear you fine, yes.
So this graph shows the updated graph of community level community transmission. It's remained unchanged. So the entire state of Minnesota remains at that high level of transmission. And so this is for cases reported December 16th through the 22nd. The next slide. then this graph shows Clay County deaths reported per week. Unfortunately, we have had 2 more reported deaths since last week. So we are at a total of 113 deaths in Clay County residents throughout the pandemic. Next slide. This is hospital admissions of Clay County residents per week. Only had 1 admission reported so far for last week and 10 for the week before. So cautiously optimistic that we might be seeing a steady decrease in hospitalizations over the next couple weeks, but there's still a lot of unknowns as Omicron has become the most prevalent strain circulating now. So we'll see as the weeks go on. Next slide. And then hospital capacity information for our local healthcare systems is shown here. Available staff beds continue to be a concern, especially for pediatric patients. So at the time of this report, there were a total of 14 staffed adult ICU beds available in Fargo and 1 pediatric ICU bed available. You'll notice though that the pediatric bed availability for Sanford was not available at the time of this report, and the VA's information hasn't been updated since the 16th of December. So kind of a delay in reporting, presumably from the holidays. Statewide in North Dakota, there's a total of 28 ICU beds available, and then just the 1 pediatric ICU bed available. Next slide. And then this is COVID hospitalizations throughout North Dakota. So overall hospitalizations are down this week. There's a total of 104 currently admitted. Last week it was at 141. 17 of those are admitted to the ICU, and there are 2 pediatric cases that are hospitalized. Again, the middle chart just shows current hospitalizations due to COVID broken down by age, and then on the right, the bar graph shows cumulative hospitalizations broken down by age. This is the updated graphic from the Sanford healthcare system. So again, continue to see the same trend week after week. It's largely the unvaccinated that are becoming seriously ill from COVID and being hospitalized. So 43 of the 46 patients that are currently on ventilators are among the unvaccinated. Next slide. And this is the updated breakthrough reports or breakthrough numbers from the Minnesota Department of Health. I did include a side-by-side comparison this week from last week's report. So we continue to see strong protection from severe illness and death among those that are vaccinated, even though we are starting to see an increase in breakthrough infections. So for this week, the cumulative percentage so far for cases among the fully vaccinated is a little over 3.9%, up a little bit from last week when it was at 3.76%. And then, hospitalizations and breakthrough deaths continue to be very, very low. So this week at 0.156% and breakthrough deaths at 0.03%. All I have, I think Jamie will continue with the vaccine data.
Good morning.
Good morning.
I apologize, my camera's not working. Can you hear me okay?
We hear you fine. Yep.
Okay, thank you. So we'll look at the statewide vaccine data as of 12/22 for ages 5 and up next. And so those that have completed just 1 dose of the vaccine from 5 and over is at 71.7% this time. And then those that have completed the series at 67.2%. So over 1.6 million boosters and 3rd doses have also been given so far. And then just looking at the breakdown, we've got 21% of our 5 to 11-year-olds that have completed the vaccine so far, 57% of the 12 to 15, and then 61% of the 16 and 17-year-olds. So we're seeing those kids become vaccinated as time is going on. And then if we can go to the next slide, please. Looking at the doses administered just by Clay County Public Health to date, 18,618 doses have been administered. This last week, we had just 77 doses that were administered. And we'll go to the next slide. And And then I'll point out that last week with the 77 doses, we did have just one clinic for the holidays, and we do have just one clinic again this week. So hopefully we'll see an increase in response after the holidays. The last week, we had a clinic that had a total of 77 doses. 4 of those were first doses and 2 were second doses. And then we had 51 that were in that booster category. And then our pediatric doses, the 6 for the first dose and 15 for second dose. We scheduled our clinic this week for Wednesday. And so tomorrow, the 29th, we'll have a clinic at the Family Service Center again in the ITB room. And that is from 11 a.m. to 3 p.m. And we're offering Pfizer first doses for 5 to 11, and then Pfizer first and second dose for 12 and up. And then the boosters Pfizer for 16 and up. And that's our plan for this week.
All right.
This is Kathy. I just had, Mr. Chair and Commissioners, I received the bulk testing site information. I didn't have it earlier, just got it just a little bit ago. And so I don't have a handout or the slide for that, but the week of December 19th, we had 981 tests that week. So up a bit more from the previous week, which was about 658. And out of the 981 tests, 5 were positive. So just a 5.05 positivity rate on that week. And as you can see, as you listen to the news, testing is become kind of an issue across the nation. Obviously, there's long lines you can see in some areas, and
You want that clarified?
lack of testing sites and kits and et cetera. So it's been kind of an issue with the testing. In our area, we're pretty fortunate that we still have our bulk testing site in Moorhead, which will remain through the winter and into the spring, as I've been informed. So it's a good place for people they can get the rapid test done there as well as the PCR test. So that's a great resource for people that need ongoing testing. And of course, they have a testing site in Fargo as well for the Cass County residents. So we have opportunities in our area for testing, and the significant long lines is we're seeing people wait hours to get tested across the United States. One other bit of information that just came up is CDC's, they've changed their guidance now as of the 27th. So they're really, as they've studied this Omicron virus, they're making some different recommendations for isolation and quarantine. So the isolation period has been cut in half, basically. It was 10 days previously, and now they're saying 5 days if you have no symptoms. If you have symptoms, you need to stay home, but 5 days for isolation if you are asymptomatic. And then you must continue to wear a mask for the additional 5 days. For the quarantine, that has been changed as well, but that's based on your vaccination status and if you've been boosted or not. So the quarantine, if you've been boosted, if you've had your primary series of vaccines, that's the Pfizer or Moderna within the last 6 months, the J&J within the last 2 months, you can wear your mask around others for 10 days. You must wear a mask, and then you test on day 5 is what the new quarantine guidance is. And again, it sounds like a lot of information with not having a slide on this, but we will definitely put this up on our website and have this information out. The other quarantine change was if you're over the 6 months period of your Pfizer or Moderna vaccine, or over the 2 month period for J&J, and if you're not vaccinated. So those are the 3 changes with that. You have to stay home for 5 days of quarantine. And after that, you need to wear a mask around others for 5 days, and then test on day 5 if you can't quarantine, you need to wear a mask for 10 days. So pretty significant changes based on information and studies that they've been doing. So we'll have all that information up on our website. We'll post it on our Facebook page as well, so people understand the changes. And of course, we're always available at our office to answer questions about those.
Okay, Commissioner Kaylee.
Hi, Kathy. When you were giving the numbers for tests at the Vault site, you said 5 were positive. That was 5%, right? Not 5 total people that got tested.
The total number of positives were 5.
So out of that 981 people that tested, only 5 people were positive?
Let me just look that up again and make sure I gave you the right information. I have to pull it up. So yes, so the week of December 19, 981 were tested. 51% were positive. I did say 5, I think, but it's 51 that were positive out of that 981.
Okay, that makes more sense. And then, thank you for clarifying. And then last question on the changes in the quarantine protocol and isolation. Our contact tracers are walking families through all of those changes too when they call them, correct?
Yes, once we, and again, this just came out on the 27th, so we haven't even met on this, but yeah, Becky will be following up with all the contact tracers, so people will have the correct information. I haven't seen the recommendations that MDH usually follows suit with those, and I haven't seen that come up from MDH yet, but we'll definitely be following up. All the contact tracers and case investigators will have all of the accurate information that we need to provide to anyone that we're following.
Thank you.
All right, any other questions for Kathy, Becky, or Jamie? All right, thank you.